I am Dr. Alex Eingorn, and this is Better Health Chiropractic. We're in Midtown Manhattan, and we've been here for over 20 years. This is really a multidisciplinary place where I work with medical doctors, podiatrists, acupuncture, exercise therapy, colon health, trichology. We also offer yoga, some meditation, and all kinds of nutritional and otherwise support. So we try and provide what's called holistic care. But me, I'm a chiropractor. That's what I do here. The word chiropractic implies done by hand. So this is a very hands-on healthcare field. But just manipulation of the spine often isn't enough to address a person's health problem. We have to stay abreast of developments in medicine and healthcare. So some of the equipment I use, for example, I do what's called non-surgical lumbar decompression. It's the DRX 9000 series machine, which is really an alternative to surgery for conditions like disc herniations, bulging discs, all kinds of stenosis problems in the lumbar spine. Which makes a huge difference. It really brings people back to life. Generally what we'll do is we will interview the patient. We will consult with them and we'll ask a lot of different questions. How much water they drink, what type of hobbies they have, what type of social and family situations they have, what type of diet they follow, what type of habits they have. Of course, if the condition is really acute, we will focus on managing that first, but as a general rule, all patients that come here are going to wind up being evaluated as a whole person. I realize that most people have better things to do than just go to the doctor, and people won't go unless they really have to. There is a certain contingency of patients that will come in regularly for regular checkups. Those are the responsible ones. But in general, my job is to help them correct what is wrong and help them just move on with their lives. So yeah, you're right. My goal is to not have them come back, because once we help somebody, of course, they will tell their friends, they will tell their family, and so it's good for us. I have quite a few medical doctors that come see me, all kinds of specialties. Primary care people, gastroenterologists, cardiologists, anesthesiologists, podiatrists. So yeah, I treat doctors as well. Having an X-ray facility on site provides me with the opportunity to diagnose problems in a very, very rapid way. Otherwise, we would have to send these patients out. Sometimes it may take a day or two or a week, depending on their schedule, depending on their insurance coverage, depending on whether they can get an appointment. And often it's a question of a timely diagnosis that will allow for a more successful outcome. So having an X-ray here is really, really a blessing. We'll always see an emergency patient here. Maybe sometimes they may have to wait just a little while, but we never turn them down. And I always give my patients my cell number. All of my patients have it. Sometimes they call me on the weekend, sometimes they can call me in the middle of the night. I encourage them to do so, because an emergency is an emergency. I understand that. So that's how we treat the patients.